We have an orgasm gap from men to women. It's because people think that penetrative sex is what causes orgasms. That's why they think we should have a bigger sized penis. But no, it doesn't work like that. Male fertility in general has been declining very steeply. Fertility का तभी पता चलता है when you're trying to get pregnant. तब तक nobody cares about it.
Meet Dr. Prateek Makwana. He is a renowned embryologist, TEDx speaker, and a leading voice in reproductive health in India.
With an Instagram following of over 1 lakh, Dr. Prateek Makwana is on a mission to raise awareness about men's sexual health issues and the reasons behind the decline in sperm count.
ED is one of the first signs that you have a heart condition. The incidence has increased now because the type of lifestyle that people live, a lot of it is office work. They're sitting at one place. There's no active movement. The body gets used to being lazy. Your blood circulation drops.
The one medicine that is very famous is Viagra.
Where people are suffering from psychological causes, we advise them not to take Viagra because now what happens is,
In today's What the Health podcast, Dr. Prateek Makwana will be discussing common myths about masturbation,
The dark side of porn addiction and how to overcome sexual health challenges.
there's a huge movement against don't masturbate. Masturbation is good for your health. If your day revolves around thinking of masturbating, then it's a problem. So now you're used to seeing porn videos, and the scenarios that will get you erected are those 30-second clips. It's in stark contrast to what it would feel in penetrative sex. Nothing can increase the length of the penis. It's the biggest myth. Even surgeries that do are extremely risky because you can just lose your erection forever.
So today I really want to focus on men sexual health
Okay.
and all the issues and myths that we would like to bust in this area. I don't think there can be a better topic to start than erectile dysfunction.
Yeah.
Please tell us more about it. Tell us, how common is it? Do you get people in your clinic very often walking in for ED related issues? And do you see that there is an increase in the walk-ins in the recent years compared to some time ago?
Yeah, I mean, I think the kind of, okay, first I'll just tell you what it is. So erectile dysfunction, essentially when you cannot have an erection which is firm enough for a penetration. That's the most basic definition for ED. And the incidence has increased now because the type of lifestyle that people live, a lot of it is office work. They're sitting at one place. There's no active movement. The body gets used to being lazy. Your blood circulation drops because you're in a bad posture all the time. And erections are all about blood circulations. That's the only thing that happens. The blood comes in and you get erect, and the blood goes out and you get flaccid. So yeah, recently the instances have increased, and even overall, just male fertility in general has been declining very steeply.
So let's understand causes, right? Ki hota kyun hai? I heard you say lifestyle, which means I'm guessing alcohol, smoking, what you eat, and physical activity, right? Please correct me if I'm wrong. इसके अलावा और क्या reasons हो सकते हैं for someone to have an issue like ED?
So alcohol and smoking will in the long term does affect it. There's a term called whiskey dick, which is when in small amounts of alcohol you get a bit of a happy high. That's when you're excited. Now alcohol naturally is a downer. It will bring you down. So when you have too much alcohol, you won't be able to get erect also. That's called a whiskey dick. It can happen with any alcohol, just the name is very catchy. That's why it goes as whiskey. But other than that, even ED, a lot of the ED causes are psychological. So if a person is in a relationship, if they have a lot of stress in the relationship, or there's a lot of stress at work and it comes down, comes back home and the environment is not very conducive, then even then it could lead to sexual problems between them, which can also lead to ED. And then it becomes a cycle because the next time they plan to get intimate, that thought of the ED occurring the previous time will come now. And that would affect the confidence. So then it
Performance
becomes a vicious
anxiety.
cycle. Yeah.
So how do you really handle this patient? Matlab, what is your treatment protocol when somebody comes in? Because now that it's complicated, right? It's
Yeah.
psychological and
Yeah.
so how do you really solve for?
So in these cases, the first thing is to figure out what the root cause is. If it's pathological or psychological. If it's psychological, a counselor would be in a better place to help them. And we have in-house counselors, so we refer them to them, and they continue their therapy with them. So that's one way. Then there are certain medications available in the market which can help you, hold an erection for the certain period of time you've taken medications. They are now all available over the counter. So those are short-term measures. For long-term, it's also just increasing your confidence also helps with it. So we advise them to just be a little active, eat healthy, because how you see yourself is how you'll feel on the outside. So that's, I think that's also key.
The one medicine that is very famous is Viagra.
Yeah.
Do you prescribe it? What is the right way? Is there anything around Viagra that people should know?
So Viagra is a medication which is used for erections, especially in people suffering from ED. Mostly where people are suffering from psychological causes, we advise them not to take Viagra, because now what happens is the medicine in general will give you a little bit of a headache and chota mota side effect rehta hai, with headache, nausea, all of these, the feeling of stuffed nose. All of these things happen with Viagra and other similar drugs. Viagra is a brand name.
Yeah.
So other similar drugs of different brands. But the idea that I could only get erect after taking a medicine, so even though the medicine is not addicting, but that thought is now causing you a dependency. So every time you go for get intimate with your partner to have sexual intercourse, you'll always lean in towards taking the medicine, because you'll think isi se it'll get better.
Hmm.
So that's something that we don't want to promote.
Hmm.
So it's better to solve the root cause.
So, when a patient comes to your clinic with a ED problem, are they young people or old people? Because in the same research I read that 25 of 100 people in the research were actually 30 years or younger. So, is it a young people problem or slightly old people problem?
So usually it's the younger people these days who are increasing in number. Yeah, before, say 10-15 years before, the larger population of people suffering from ED would be over the age of 40-50. But now it's the younger people who are increasing in number, because एक तो lifestyle ऐसी है, plus there's a lot of stress just to increase their career. Like the career growth now takes precedence over everything else. So that's one of the reasons that we see a lot of 24, not even 24, but somewhere around 28 to 32 wala bracket. That's where the most patients of ED have now started to come.
And what stage are they in when they come to you? Like, have they tried multiple things before? Do they come to you immediately after few cases, or you feel कि अरे ये तो बहुत late आया है मेरे पास? Like, what stage are they?
There's no such thing as people coming late for a treatment, especially in ED, for a psychological cause. Pathological, yeah, of course. But it's a mixed bag, because sometimes when people come, they have tried a lot of things, especially with social media now so accessible. They have seen a lot of things they've tried that didn't work probably, then or maybe worked for a short period of time. Some people have already consulted a few doctors and they now they just want to do an online consult. They don't want to visit. And then there are some people who have just experienced it probably 2 or 3 times and they're very fresh into it. So, from all sectors you get doubts.
Dr. Prateek, are there any other health conditions or diseases specifically related to ED?
I mean, basically anything can affect your ED. ED is one of the first signs that you have a heart condition. So because the penis works on blood flow. So if you have a cardiac condition, one of the first ways the body will give you a signal is through erectile dysfunction.
Is there any connection between diabetes and ED?
Of course, because diabetes messes up your hormones. Once your hormones, because everything is in the brain, like the whole pituitary axis is in the brain, which comes down and it affects your fertility. Even for women, the release of estrogen, progesterone happens to the ovaries, but FSH and LH release is triggered from the pituitary axis. So everything works in coordination. So if you have diabetes, if your insulin resistance is through the roof, and your sugar is not controlled, your body will go through a lot of changes which will affect your erections.
Do you think there's a important role that the partner should be playing if the person is going through ED? And is there anything that wives or girlfriends or the partners should know on how to support uh, someone going through ED?
Probably just be supportive of your partner. I think because in a lot of these situations what happens is, especially in today's world, because people are very quick to people are very impulsive with their decisions. So now when something like this happens, it may lead to trouble in the relationship, it may lead to trouble in the marriage, and that does not come out very nicely for either one of them. They both lose confidence. Probably the partner thinks that maybe he's not interested in me, the guy is just trying to sort of figure out how to not go into that same cycle. So it just messes things on both the sides. Just being a little supportive, and you can still have sexual intimacy without having penetrative sex. So just exploring that side also could be better for both the partners.
In fact, we were doing some research on social media and we saw that there were a lot of beliefs around ED, like porn addiction से ED हो जाता है, एक्स्ट्रा मास्टरबेशन किया है इसलिए ED हो जाता है, कुछ खाया इससे ED हो जाता है. So really want to understand, is any of this true?
So there's some truth to it. The rest of it is false. Now, see, there's a huge movement against don't masturbate. You'll save your life force, and a lot of these things go on. But the actual idea is that if everything above moderation is going to be harmful to you, no matter what it is. It could be the healthiest thing in the world. You go over the recommended level, it'll be harmful. The same with masturbation. If your day revolves around thinking of masturbating, all your actions are like, no, I just want to go home and masturbate, then it's a problem, because now you're used to seeing porn videos, and people want that quick dopamine hit. So they'll see multiple sections of different videos, and when you masturbate, your body gets used to that feeling of that particular action, and you're trying to experience the same when you're with your partner. It's not going to happen. Your hands, it's usually a very tight grip. It's called a death grip syndrome. And then the palms are usually very cold. It's in stark contrast to what it would feel in penetrative sex. So I think that is something that might lead to porn related ED. And to curb that is obviously like you have to let go of watching porn throughout the day, and trying to probably limit your masturbation to a few times a week or something like that. There's no right number, but you have to reduce it at some point.
And what is your opinion on remedies other than what allopathy recommends, right? Because there's Shilajit and there are aphrodisiac herbs. There are so many remedies in this space. Is there anything that you would recommend a patient coming to your clinic, as
Yeah.
your tip?
So what I would say is, a lot of the Ayurvedic herbs now, they're not targeted to help you with the erection. They might have a range of benefits, which in turn will benefit your whole body, as a whole, if it does benefit. Because sometimes a lot of brands just source their ingredients from it can actually do more harm than good. So yeah, it matters, and there's no wonder ingredient to get better in ED. If it's psychological, nothing that you eat is going to help you. It's just how you feel about yourself. With ingredients like Shilajit, it's again a matter of where the brand is sourcing it from, what's the quality, because it can actually cause harmful effects if the quality is not good. And with the competition in this space of nutraceuticals, yeah, you never know.
Moving from ED, the next big problem that we figured in our research is this whole obsession around penis size. And I want you to go out and say size does not matter. But for some reason, people are obsessed about it. And there are products around increasing the size, there are everything being sold around it. Um, have you encountered any interesting experience where people have come to you for issues around size?
Yeah, I mean, a lot of it I think comes from the fear mongering which is done through, because what, see, where do people learn about sex from the youngest possible age? It's porn sites. And what you see over there, people are just like, maybe this is how it should be, you know. And I think that's something that is a very wrong message that people get. Now, yes, people can have preferences, your partner can have a preference. That does not mean that size matters. Absolutely does not. And that's why there are multiple ways to use whatever you have. There are multiple positions which you can try to improve the impact. And you know we have an orgasm gap, with from men to women. There's a huge orgasm gap. It's because people think that penetrative sex is what causes orgasms. That's why they think, oh, we should have a bigger sized penis. But no, it doesn't work like that.
So, do people actually go and do surgeries for this?
There is a penis lengthening surgery available as a procedure. What it'll do is it'll probably, so there's some tissue of the penis inside the body as well, and it's held on. What the doctors will do, the surgeon will do, is will remove those handles, or the tendons which connect, and it'll release the tissue out. That's probably an inch, or max 1.5 inch extra. Now what that can do is that can affect your erections for life also. So this is a very risky surgery which doctors usually ask not to get it, because size does not matter, and it's just like it's just in the head of the people. So better not to go for the surgery.
I understand this is dangerous, but is this something that people in India also go for?
I mean, I'm sure there's a population for it. I mean, it's obviously not as recommended. The doctors would also ask you not to go for it. But then there's some people who are like, no, we want to try it. So then they go for it. And if it works out, it works out. If it doesn't, it doesn't. There are a lot of complications, post-surgical complications with this, with the penis lengthening surgeries.
What kind of complications can the surgery cause?
So now the problem is that because it's already being held inside, the erections which come, it pushes the penis upwards. When the tissue is not when the ligaments are not holding the penis tissue inside, now it'll just flop around straight. So now the erection, even if it's there, it won't come up. It'll just be facing downwards. So that affects a normal erection, how it works. Plus, with the surgery, there's lots of post-op pain. It could cause you a pelvic injury because it's in the pelvic region. And that can also in long term almost like, unable for you to get erections now, even with medications. Now there are other ways to do it. They have inflatable implants and all. So that's where you have to turn to. So it's better just not to go for penis lengthening surgeries.
डॉक्टर प्रतीक, अगर आपके क्लिनिक में कोई पेशेंट आए और बोले कि मुझे साइज का प्रॉब्लम है, और what is your first sort of approach?
I think the first approach is to just make them realize that, yeah, a lot of people have this doubt. It's not something that only you have, and it's not something that only you worry about. It's pretty normal for people to, think that, oh, if this was better. It's like with everything in life. Somebody's driving a car, you're driving a car. If they have a better car, you want that car. That's the same thing that applies to penis lengths also. But then to just make them realize that the size is not the problem. If there's a problem that's happening, then you can do things to correct it. You can improve the sexual intimacy in your bedroom, but the size is not going to help you with that at all. In fact, people with too big of penises, they cause more pain than pleasure, and then their partners are usually not interested to have sex because now it's painful, and it's not the pleasure wala pain, it's like proper pain wala pain. So it's better to just make them realize that it's pretty normal, and what you see in the videos is a lot of time just a video. There's like layers to that video before it comes out. There's a lot of post production that happens. So yeah,
I think your profession, a large part of your work is counseling and talking to. Do you see that people find it very difficult to open up even with you when they are coming and meeting you?
yeah. So because a lot of our patients are IVF people who want to go for IVF, and infertility is because impotency sort of is the word which was initially used for erectile dysfunction, not used anymore. So erectile dysfunction, premature ejaculation, all these things, they can lead to infertility, but there are of course a lot of causes. So when people come to us, And sometimes, this is one funny incident, because it's in the history we do ask that, how many times do you get intimate in a week or in a month? So the wife goes 5 times a month, and the husband at the same time is saying 7 times a week. It's like, how is this happening?
Wrong stats.
Yeah. That's why you always need both of the partners to be present in the OPD.
Funny. I think that's another topic that I really want to spend time on, which is infertility. आपके इतने IVF सेंटर्स है, और मुझे पता है कि जितने भी मेरे अराउंड लोग हैं, they are finding it difficult to get pregnant, who are trying, right? Infertility has become such a big problem, but nobody talks about male infertility. And while I was researching for this chat, I realized that WHO ने 2019 में एक स्टडी की थी जिसमें बताया था कि इनफर्टिलिटी के जो पेशेंट्स थे उनको स्टडी किया, 50% was due to male infertility. It's not like, women is the major contributor to infertility. How do you deal with men accepting the thought of, especially in a country like India, which is patriarchal, आप कैसे handle करते हो?
This is a very common statement that we hear when people come to see us, is that wife का IVF करवाना है.
हाँ.
It's a very common statement. That's why we always ask them कि नहीं, हमको दोनों के टेस्ट करने हैं. You have to test the husband also and the wife also, because only then you'll be able to find out. Now, 30% of the cases are due to the female factor of the infertility. 30% of cases are attributed to the male factor. Then the remaining are combined causes, where both of the partners can suffer through something. And then there's a 10% which is left, which is for unexplained causes, which we have no idea about. Everything is normal. They have tried naturally. We have tried different methods before moving to IVF. But nahi ho raha. So that's unexplained infertility. In these cases, especially the male infertility cases, because it's a mandate for us, I think for all the IVF centers in the country, they will always test both the partners. That is not negotiable. And only then, if there's a problem with the sperm, with the semen, then we will counsel the patient accordingly. The sperm count is low. There are certain ways to help you get pregnant. If everything seems normal, we would ask them to try timed intercourse, which is when you have intercourse in the fertile window of your menstrual cycle. So these are certain things that we do. And if it's a pathological cause for either male or the female infertility, because there are a lot of causes. In men, it could be testicular cause, and then even in testicular, there are differentiations. One is, so where the sperm production happens. So it's pre-testicular. Testicular is inside the testicle. Post-testicular is where the ejaculatory ducts are, which will lead finally to the semen coming out of the body. So any three of these spaces can have pathologies. So you just have to counsel the patient like that. That it can happen. The treatment is available for you. You have to accept that, it's a male factor.
Would there be any advice that you would like to give to men who are trying to conceive? Because there's a lot of advice for women who are trying to conceive, from giving water in the morning to the sun to whatnot.
Yeah.
So, what is your advice to men who can they do something to improve their fertility?
There are a lot of things you can do to improve fertility, but they all rely on your habits, which you can control. What you can control is your external stimulants, your lifestyle, your work ethic, having some physical activity, having ways to reduce your stress, seeking help for any other medical causes that is already going with you. All these things will have a better impact on your fertility. There's a line that we say in medical that the most cliched advices are the best ones and the hardest ones to follow. So when you ask someone to eat clean and work out, like हाँ हर कोई बोलता है, but करता कोई नहीं
सबसे
है.
जरूरी है.
But nobody does it. When we talk about holistic health improvement, you'll improve your cardiovascular health, you'll improve your respiratory health, you'll improve your muscles and all. But fertility is always sidelined. Sexual health is always sidelined until it's time to get pregnant.
Hmm.
So take care of it pehle se na, it'll help you.
Does quitting smoking alcohol in men also can improve fertility?
Oh yeah, definitely. I mean, I think smoking is, see, with alcohol you can still have, okay, you drink with the recommended limits of whatever. Every society has a different recommended limit, the medical societies. But you can reduce the intake, and you can just socially drink maybe 1 or 2 glasses, say, in a week. That should be fine. For smoking, there is no such rule. Smoking is going to harm you, be it active, be it passive. Passive smoking will do just as much harm as active smoking. But then there are people who, so especially on my reels of smoking, there are people who comment कि मेरे दादा के तो 8 बच्चे हैं, वो तो अभी तक पी रहे हैं. हाँ, बट तुमको हो जाएगा तब क्या करोगे?
हाँ, दादा का जमाना अलग था, उस जमाने में
Yeah.
सब हो जाता था.
maybe 1 or 2 cases में नहीं होता. Of course the body reacts differently to everything, but why do you want to go and risk it and then realize that, oh shit, मेरे को तो हो गया. So yeah.
So I think this is great, but for men who are not yet at that stage where they are planning to get pregnant, is there something they can do other than these things to ensure that their sperm count remains healthy?
I think besides all these advices, which we have already talked about, especially men who are not, say, in a relationship, or who have multiple sexual partners, it's a very important advice for them is that you have to wear protection, because unwanted pregnancies is a different thing, but the exposure to STIs, it can harm your fertility. It can harm a lot of functions in your body because of how the disease develops. HIV, we all know, just shuts your immune system down. So a lot of STIs are, and the fact is that STIs, people cannot see and say that somebody has an STI. Sometimes you would not even know that you have an STI, and you might just transmit it to someone else. तो तुम्हारी fertility, तुम्हारी health, fertility सब जा रही है, उनकी भी जा रही है, कोई भी treatment नहीं ले रहा है. So especially for people with multiple sexual partners, an advice to them is that you get tested every 6 months. An STI panel किसी भी path lab में मिलता है. There are multiple range of diseases: HIV, hepatitis, syphilis, gonorrhea. Just get the whole panel done every 6 months if you have multiple partners, and it'll help you a long way just to maintain your sexual health, fertility, just your normal general health as well.
I think that's a very interesting tip. Dr. Prateek, what is the fundamental difference in male fertility and female fertility that people should, or male infertility and female infertility rather?
So either way, I mean, they both mean the same thing. So fertility is the ideal term. Infertility is a lack of being fertile. The main difference is the reproductive organs. They are built very different. They have homologous organs which appear from the same anatomy but have different functions. But in women, say when at birth, they have a certain number of eggs. By the time they reach puberty, they have over 400,000 eggs left. That's all the eggs they'll ever have. They won't produce anymore. And every month, a lot of eggs are developed in the ovary, but only one is released. All the rest, they die out. So one is released. Now so just with this stat, you can have your menstrual cycle for the age of about 44 to 48 in India, which is the menopause comes at 50. That's the average age. So you have a limited number of cycles, and the body's idea is always to push the best egg first. So as your age increases, the quality of your eggs is now going down. After 35, the quality, the decline is still not a lot. After 35, it's a steep decline. The time you reach 40, the decline is even more. So it becomes harder and harder for you to get pregnant. And even if you do get pregnant, the chances of a baby being born with, say, Down syndrome or any other syndrome is going to be much higher. Not a necessity, but much higher. In men, the reproductive system is not as complex as women. The sperms are made every day. Yeah, there are things which can affect the production of sperm, of how the quality of the sperm would be. But this is the fundamental difference. And there's a very unfortunate fact, I wouldn't call it fun fact, is that most of the medical research is done on male bodies and has, from the ancient times, when all the literature that we have has come from the ancient times, was done on male bodies and applied to female bodies, even though the reproductive organs are absolutely different. But in infertility, all the research was done on female infertility, and male infertility was sidelined.
So it's not just common
Yeah.
people problem, it's also a medical world
Yeah.
problem.
So now, and we see that women bear the brunt of it.
There's another very interesting data point that I read was that over the years, the sperm counts or sperm count have gone down by 50%.
Yeah.
What does that mean, and why is this happening?
So it's true. It's absolutely true. Now what happens is 15 million is the lower end of the sperm count. उससे कम हुआ तो we call it oligospermia, which is low
Okay.
sperm count.
Okay.
15 million के ऊपर है, which is, it's a good count, you know. Now the sperm count going down can still be in the normal range or can still go under the normal range. There's no mention of that. But what has also happened is testing has increased. Now, the more people you are testing, the more people coming for infertility treatments, the more you're discovering. While on the side, all the lifestyle habits have gone to, have become worse. This career-driven mindset, which is great for your career, but if you don't take care of your body on the side, it's going to affect. So there's a lot of people with sedentary jobs, 9 to 5 office jobs, who don't take care. They go home, they just eat whatever junk they get, and they just sleep off. So they're not taking care of their bodies. So while all that is happening, a lot of people are becoming now more open to getting tested. So all of these things together across the world has led to a decline in sperm count in general.
I want to briefly cover IVF as a topic, especially from the male context.
Yeah.
Men who are listening our chat today, if they are thinking about IVF, what is it that they should know? Because we don't want them to go to their doctors and say, meri wife ka IVF karna hai.
Yeah. I think when they go to a IVF center, they should be pretty open-minded that, both the partners will be tested. The treatment will go accordingly. And so semen analysis is a very basic test. Again, the test for women are, there's FSH, there's AFC, we do an ultrasound, then there's AMH levels. Men में testosterone तो देखते ही हैं, बाकी blood tests दोनों के same होंगे. And there's just one test now that you have to masturbate in a cup and semen analysis हो जाएगा तुम्हारा. Your sperm, your semen quality would be assessed. कितने sperms would be assessed. That's one of the first points of contact. उसके basis पे we'll look forward what to do. And then people suffering from different conditions will also have added tests. But yeah, so this is something that people should be, because a lot of people get anxious. Like when you ask them, to give their sample in the hospital, they are unable to, because now they have anxiety. They get anxious while coming into and they go in the room and they're like, it doesn't happen.
What am I doing?
Yeah. And so sometimes it's also pretty common practice to send the partner also in the room, because then the anxiety comes down a little and then they're able to give a sample. This is something that people should know before coming into an IVF center, कि test से wife का नहीं होगा, दोनों का होगा. And a lot of times people also get their in-laws, because वो आ जाते हैं लड़के के. If they don't do that, that's better for both, because now they are both very shielded off, to send the in-laws out and just keep the patients.
So IVF में होता क्या है? Test we have understood. Can you explain the process a little bit on how the whole sperm extraction happens and how IVF is done?
A normal, when you can get sperms in the sample, what will happen is we'll take the sperms, जो sample में आए हैं, we'll take the eggs out from the ovaries. It's called an ovum retrieval or egg retrieval. We'll take the eggs out, we'll take the sperms out. Then we'll culture the eggs for a few hours. Then we'll inject the sperm. We'll take one sperm per egg. So this is called an intracytoplasmic sperm injection, which is you inject a sperm in the cytoplasm of the egg. Or otherwise, there's another method which is more related to, which mimics the natural conception more, where you keep the egg and you deposit sperms around in the same dish where we have kept it, petri dish. So it's called a test tube baby, but test tube नहीं use होती culture के लिए,
Petri dish
petri
baby.
dish होती है. It doesn't sound good. That's why.
Interesting
Yeah.
fact.
So then, in intracytoplasmic sperm injection, or ICSI for short, we take one sperm per egg, and we have to pick the sperm very properly, because now we are doing the selection process. The egg is not selecting naturally, and in the other procedure, the egg chooses the sperm. In this, we are choosing the sperm for the egg. So it has to happen very properly. Some sample को we'll prepare a sample in a way that everything else, because semen के अंदर only 10% is sperm. Rest everything are secretions and glandular secretions. So you have to separate everything. You just want the sperm. Then you pick the best sperm. This is what happens in a natural cycle. In a cycle where you can get sperms in the sample. Sometimes you won't get sperms in the sample, which is what we call azoospermia. Zero sperms in the sample. The causes could be many. In that case, we prefer taking out sperms from the testicles. So that's an extraction. So there are multiple ways of doing it. One is a proper open. That's the last possible when you want to find just one sperm in the whole testicle. So that's a very long procedure. But the other procedures, they're very short. You just inject a needle in. There's local anesthesia given, and you just pump out some of the tubules. In the lab, we'll scrape the tubules off, we'll pick the sperms, and then we'll inject. That's a sperm extraction. This is what happens superficially in an IVF cycle.
Dr. Prateek, let's move to infections. For women, there are multiple infections, and more commonly known infections like fungal, yeast, bacterial. Explain us what can go wrong in terms of infection for the male genital area, and is it common or is it comparatively less common?
So you have the same infections. You have the bacterial infections, you have the fungal infections, which is yeast is the most common, both in men and women. There are similar infections in men also. It is just as common, and there's a little difference with in the classification of infections. So there's a urinary tract infection, and then there's a sexually transmitted infections. They're both different. They present as same in a lot of cases, but they're both different. You'll get, like how there is itching which happens for women, the same itching also happens in men. So symptoms would be similar, just that UTIs are not as common. The rate is lower, but it still happens. And STI can happen to either of the partner just on the basis of contact, sexual contact.
Can you explain a little bit about STIs that people must know, things that they must know in terms of symptoms to sort of keep an eye on, things to avoid, mistakes that they might be doing? Like you just spoke about the panel testing, which was a very interesting tip. What are the other things that people should know to sort of keep themselves safe from these infections and STI?
So there's a wonder drug. It's the HPV vaccine. It can, just taking that vaccine for both men and women is pretty important. Yes, in women, cervical carcinoma. In men, similar to cervical carcinoma, is also another carcinoma. So HPV is, the virus, the human papilloma virus. It's the only cancer preventable via vaccine. It would not be treated. It can be prevented. So you have to take it, early on. Ideally, it is recommended that you take it before your first sexual encounter. So, जो ages होते हैं, which is 9 to 16, तब लेना चाहिए. But क्योंकि इंडिया में वो awareness का wave last 2-3 साल से ही आया है. But it's good. अभी now they have released a mandate for boys also. पहले नहीं था. And so that is one thing that people should do for sure. Second, also just with the HPV vaccine, everyone has had contact with HPV at some point in their lives. HPV has over 100 strains.
Wow.
All of us in this room, everyone in this building has had some form of HPV infection in their life. It's just that the body fights it off. There are 4 strains which causes, 2 of them are responsible for warts, genital warts, happens both in men and women, and 2 are responsible for your HPVs, the actual cervical carcinoma. So that's what the vaccine does. So vaccine भी ऐसे अलग अलग आती है. One is quadrivalent, 4 strains, the 4 commonest. Monovalent, which is 9 strains, and now there's a 16 strain vaccine. So definitely get that. Second, no contraception besides a condom can save you from an STD. So for STI, you just have to use a condom, because you take a pill, you take an IUD, you will still get in both the partners. I mean, whoever has it can transmit it to the other one. No amount of contraception besides a condom will help you be safe from an STI. So I think that's the most easily available, the cheapest, the easiest to use, no side effects. Just use it.
Dr. Prateek, is there anything around foreskin that people should know? Is it good to have in terms of, from the context of infections? Does it protect from infection? Because I mean, in our research, this is one thing query
Yeah.
that came in to us, where people were asking about what is a better, from the science perspective, a better approach for men.
A foreskin is like, just as a very important part. The only thing is that you have to clean it regularly. You have just like every body part, you clean your face regularly, you have to clean your genitals also regularly. So penis, you have to wash, you have to roll the foreskin down and wash it under the foreskin. Otherwise, smegma is a thing which is bacterial cells, plus the the unwashed, all the oil releases and all, they all develop as it becomes like a white paste.
Mhm.
So that is not good for you. And there can be issues with, if the smegma is not clean for a longer time, then there can be issues with just pulling the foreskin back above the head of the penis, and that can be very painful. So in those particular cases, I mean, we ask people to just like be a little more proactive with cleaning their penises every day, just maintaining hygiene. It doesn't matter if you have a foreskin or if you don't. Everything is the same. Besides pathological reasons, like I just mentioned, when you're unable to pull the foreskin back, or unable to pull the foreskin forward after the erection is gone, because now it has constricted behind the head of the penis, and this can cause like a blood circulation ka drop. So your head is now without a circulation. So in that particular case, you have to again remove the foreskin. Besides these, I mean, there's a religious angle to it why people do it. Otherwise, there's no other reason. I mean, if you want to go, it's an optional procedure. If you want to go and remove your foreskin, if you get in circumcision, you can. If you don't want to, you don't have to. You just have to maintain hygiene a little bit better.
Dr. Prateek, I want to move to this segment, which we call as What the Health segment. Basically, I will read some sentences and beliefs that we have captured from people, and I need your help to tell me myth versus reality.
All right.
Okay. So I'm going to read out. The first one is, men don't suffer from UTI.
That's a myth. So now what happens is that women are more prone to suffering from UTIs because the distance from the vagina to the bladder is less. In men, it's longer, but they do suffer from UTIs. It's absolutely normal. You get bacterial infections, you get yeast infections. So yeah, and if checked timely, they're very easy to treat.
Energy boosting drinks and protein shakes do not affect sperm count.
So that's actually a fact, but there's a little caveat to it. Caveat is that in protein shakes are good, but where you buy it from is an issue, because 80% of the market in India is of fake proteins. So it'll put pressure on your kidneys. Fertility is the last thing you have to worry about right now. Your whole body is going for a toss. So yeah,
So worry about your kidneys first.
yeah, I mean, just buy genuine stuff.
By genuine, agreed. Weight doesn't affect fertility.
No, that's a myth, because your weight is a very key component of your BMI. Now, BMI is already a very obscured reading, but even then, your hormones go for a toss when your weight is not controlled, it's unchecked. And especially if you have other conditions, diabetes, India is the diabetic capital now. So, thyroid related issues, the weight going unchecked in these situations, and also obesity in general, will affect your hormones. The hormones in turn will affect your fertility. And it's the last thing people always check, because fertility ka tabhi pata chalta hai when you're trying to get pregnant. Tab tak nobody cares about it.
I definitely knew that weight is an important in women for fertility, but I did not know that it also sort of
The same principle applies in men also. Yeah, the reproductive system is a little more complex in women, but the idea is the same.
Um, Age doesn't affect male fertility in the same way it affects female fertility.
That's a fact. It does affect fertility. I mean, the sperm count, the sperm quality, and there's a thing called DNA fragmentation index. It's the integrity of the DNA in the sperm cell.
Mm.
That also increases, and that's not a good sign as the age goes on. But how eggs are limited? Sperm Formation of sperm is like a factory. It happens every day, and it takes around 60 to 72 days for a fresh batch of sperm. But that batch is being produced every single day. So by the time this, and eggs are limited. So after 35, there's a steep decline in the quality of eggs. You're left with very few eggs, and you can get naturally pregnant also, but the chances of congenital anomalies, your baby being born with diseases, is going to be higher. With men, it's not so much. It does affect after 40. The DFI, the DNA fragmentation increases quite a bit more, but not as it's the effect is not as serious as it's in females.
Men experience sexual anxiety.
Yeah, that's a fact. I think humans experience sexual anxiety.
Yeah.
There's no differentiation in that.
Masturbation causes sexual problems. I think you just
We've
answered.
just discussed. I mean, it does not, but there's a limit to it.
Testosterone boosters improve sexual performance.
That's a myth because testosterone boosters are the worst possible gimmicky products on the market right now. Testosterone is a hormone. The only way you can get into your body is through HRT or hormone replacement treatments, right? Otherwise, there's no way to get testosterone in your body. You cannot boost it. No ingredient will be increasing your testosterone directly. And you can actually, all those, like we already discussed, how these products can be really harmful if not being made properly.
Sexual dysfunction, for example, ED, is just a hormonal problem.
No, not really. I mean, we discussed it. It's psychological or pathological.
Pills, creams, gummies can enlarge penis size without surgery.
Nothing can increase the length of the penis. It's the biggest myth. Even surgeries that do are extremely risky, and doctors usually advise not to go for that surgery because you can just lose your erection forever.
I'm so glad this point was here in this list. If you have trouble getting an erection, it's because you are not attracted to your partner.
I think that probably would be the last on the list if there was on a
list.
hypothetical list, yeah. But no, there are a lot of things that can affect erections. Attraction probably, for if you have a partner, then I don't think that applies. If like if you're in the generation of just randomly hooking up with people, it could be a point. But if you're with a partner, I don't think that applies.
So, Dr. Prateek, we went out in our social community and we told people that you are coming in, and we got in some questions.
Okay.
I have a list of these questions here and I need your help to get them answered.
All right, I'll try.
Okay. Hello, I am a 35-year-old man who is experiencing venous leakage. I have been taking Ayurvedic and allopathic medicine treatments for the past 2 years, but unfortunately, the leakage persists. I am seeking advice on a permanent solution to this problem. Can you please help me? Thank you in advance.
I think what they mean to mention is they're facing problem with urinary incontinence. So in that case, I think visiting a urologist would be a better idea, and it's better if they go into it because urinary incontinence becomes a lot of trouble for people, because your clothes get soiled. If in case what they're mentioning is sperm leakage or nightfall, that's absolutely normal. There's nothing to be done for that.
I'm 21 years old and have Peyronie's disease. Is that the right pronunciation? I want to know if it was caused by excessive masturbation. Also, can this disease be treated or does it heal on its own?
So now what happens is sometimes penises come in all angles and all shapes. Sometimes there's a bent in the penis, which is a very it's closer to the 90-degree angle. In that case, the erections are very painful. So now what happens is, because there's a scar tissue which has pulled the penis towards like at a 90-degree bend. So every time you get erect, the 90-degree erection would be extremely painful. In that case, one way is to remove the scar tissue. which will help. So a surgery in that case would help. And the scar tissue can always grow back. So yeah, I mean, get a surgery, but also just know that it can happen again.
But who's the right doctor to meet in this case?
A urologist or an andrologist. Yeah,
I have recently been diagnosed with
paraphimosis.
which I previously thought was just regular phimosis. I had to undergo surgery as a result, but I'm still experiencing psychological issues when it comes to sex with my partner. Can you offer any advice on how to treat or eliminate this?
So because it's a psychological issue, going to a sex counselor or a sex therapist would be a better idea. They will be able to help you because I've already got treated for it. So I think the only thing is now just to get, because with phimosis, like I explained, the foreskin does not come down and it becomes very painful. So even though you try it, it becomes painful. Intercourse becomes painful. So I think that is what the psychological issue is, that because that reminder of the pain can cause, yeah, it can be a little troublesome. So in this case, seek counseling and it will help. Just, you don't have to rush it, you don't have to rush into it. You just take your time with the counseling, practice some masturbation by yourself so that you become more used to the idea of erection and intercourse, and I think then just gradually go forward with it.
Hi, doctor. I'm 23 years old. My question is, does taking a steam bath twice a week after a workout session affect my sperm count?
Oh yeah. So the testicles hang outside the body for a reason. They don't want the body heat. In winters, the testicles come up to the body because now they want the body heat. So the testicles like to remain 2 degrees lesser than the normal body temperature. Frequent saunas and steams, you're raising the temperature in your testicles. You don't want that. It will affect sperm production.
सर केगल एक्सरसाइज कब तक करें? अगर मैं लाइफ टाइम करूं तो कोई साइड इफेक्ट तो नहीं होगा? मुझे ईडी नहीं है, क्या मैं एल आर्जिनाइन पाउडर ले सकता हूं? कोई साइड इफेक्ट तो नहीं होगा?
L-arginine is like how you have co and CoQ enzymes. They're very empirical. You can take it as a supplement like multivitamin. तुम लेते हो. People take amino acids. Arginine is an amino acid. So of course they can take it. I mean, unless they have an allergy to any of the ingredients. Agar it's only L-arginine, then yeah, go for it. And there was another part. Kegel exercises. Yeah. Kegel exercise, I mean, they can do it lifetime. It's usually to help with premature ejaculation because you want to control the stream of the urine midstream. So you're just working your pelvic muscles in a way that, you won't be able to do it in the gym. But yeah, I mean, they can do it. Just don't overdo any exercise. That's it.
सर 11 साल की उम्र से मास्टरबेट कर रहा हूँ. 16 साल का था तब से ईडी जैसा लग रहा है बिकॉज ऑफ माई हेल्थ कंडीशन. आई एम 24 नाउ. सब ट्राई किया बट नॉट वर्थ इट. अभी पैसा कमा के इम्प्लांट करने का सोच रहा हूँ. क्या मुझे इम्प्लांट करना चाहिए?
I think the first thing would be to correct whatever the health condition is. If that's corrected and if testosterone levels are normal or they come to normal, otherwise hormone replacement is also available. If all this is in order, then they don't need an implant. This is what I mentioned, that when you overdo masturbation, masturbation is good for your health. But when you overdo it, you get used to that particular scenario only for your erection. Now being with your partner, your sexual drive is absolutely low now. Because the scenarios that will get you erected are those 30-second clips and the cold, sweaty feeling of your hand. So that needs to change.
My husband and I have been married for 5 years but haven't been able to conceive a child. We consulted with a doctor who recommended a sperm examination. The result of the examination revealed that my husband has a low sperm count. We're wondering if IVF is our only option or if there is a possibility of improving my husband's sperm quality and count.
Okay, so based on this, because sperm count is not mentioned how much. So if it's, like we discussed, 15 million is the lower limit. So 10 to 15 is what we call mild oligospermia, where certain medications, like empirical medications like coenzyme, can help, in 3 or 6 months to increase the sperm count by a little, not drastic. IVF is not the first option, it's always the last option. So you have other options, like we've already discussed time intercourse. There's timed intercourse with ovarian stimulation, where you give drugs to stimulate the ovary to push out the egg, and at that time you have timed intercourse. Then you have IUI. It's called an intrauterine insemination. In this, what happens is you just take a catheter, you prepare the sperm, you take the catheter, you load the sperm sample in it, and you inject it in the uterus. So you bypass the vagina and the cervix, which is where most of the sperm clearance happens. So in a natural conception, uh, million sperms are deposited in the vagina, 10, 15 million, 20 million, whatever. But only 1,000 reach the egg. So the majority clearance happens in the vagina and the cervix, because vagina is a more hostile environment to the sperms. So that IUI is a way. It costs 10 times less than an IVF cycle. And usually we do 3 IUI cycles for people who have sperm count, which is around mild oligospermia. This is like across the whole country. This is the protocol. And after that, if there's nothing else, so in some cases like IVF is the only option. But if this is the case, then yeah, if everything else is normal, they'll probably do an IUI, and then if no success comes, then IVF.
Hmm. Hello, sir. I will be turning 32 next month and my wedding is coming up soon. I want my fiance to take some STD test before the wedding. How should I approach him with this topic without hurting him? Also, could you please let me know which tests are necessary?
I absolutely love this. I think कुंडली से मिलना से अच्छा है पहले एक बार अपने STI tests की report देख लो. That is very important, because apparently if you know that you have an STI and you knowingly transmit it to someone, it could become a criminal case also. This is what I've read. So don't quote me on this, but yeah. So I think that's a very good choice. And just ask upfront, maybe like be polite about it, but ask upfront. And while doing that, also get yourself an STI test, so that it's not just get me koi dena hai. It should come from
Dono correct.
both the people. And I think that usually just makes more people like comfortable with the test. The number of tests that they can get is HIV, hepatitis, herpes, gonorrhea, syphilis. And there are a few more tests in the panel if required. They can just get the whole STI panel done.
Hi, doctor. I have 2 kids and we conceived one even when I was actively using a condom. I want to get a vasectomy done to avoid further mishaps, but I have heard that vasectomy is quite painful. Are there any other methods that can be done to avoid unwanted pregnancies from my end?
So in this case, probably the condom wasn't used properly, because if you don't use the method properly, it's going to fail. That could have happened. So maybe just using it properly is enough. But also vasectomies now are not painful. They have a lesser post of recovery time. So the recovery is quicker, and it's not, earlier it used to be painful, but now it's minimally invasive. It's done very quickly. The recovery time is less.
What is the recovery time?
Anywhere between a few weeks to months. So like 3 weeks to a few months. And in this time, you cannot have unprotected intercourse. You will still have to use a condom. So what people do is after 3 months or after 6 months, they'll again ask you to ejaculate. And when all the sperm has cleared out from the section of the vasectomy means vas difference. Anything with ectomy is essentially removing from the body. So vas को they'll just clip, तो एक साइड जो टेस्टिकल का कनेक्शन है वो रुक जाएगा, और एक साइड जो इजैकुलेशन का कनेक्शन है वो दोनों को बीच में क्लिप कर देंगे, हाईवे बंद कर देंगे basically. So yeah, they'll just do a final ejaculation and see that there's no sperms now in the ejaculate, and then you can have sex without a condom.
Hello, I'm a 24-year-old man experiencing nightfall issues for the past year. I used to watch a lot of porn, which caused me to have bad dreams, and I believe this is the root cause of my problem. Recently, I've also developed a precum issue while urinating, and I am experiencing a lot of joint pain. Could you please suggest any treatment that might help with my issues?
So nightfall is actually absolutely normal. What nightfall is that it's the body's way of pushing out the dead sperms or the excess sperms, because they're made every day. So if you have taken a long break from masturbation, the body will push it out. Like how body sweats and push out toxins from the body, the same way nightfall works. It's absolutely normal. The joint pain may not be related to it at all. It could be something else. It could be a vitamin D deficiency or a vitamin B12 deficiency. And I think for the pre-cum issue, it could be because if I think they've mentioned that they have a history of repeated masturbations. So this is what happens when a lot of probably the whole of the day you're thinking about masturbating, and the images that you look in the porn are making you like get aroused, and you're just waiting to go to your room. So that arousal can cause pre-cum, because pre-cum is it's involuntary. There's nothing wrong with it. It happens, and it only happens in a state of arousal.
Thank you so much, Dr. Prateek. Those were all the questions that I had. I think what I'm really taking away from this chat is it's very simple to stay away from sexual health issues. All you got to do is stay healthy, in one word, right? So if you don't have any health issues, if you are working out, you're sleeping well, you're eating well, then aapka fertility, overall sexual wellness is going to stay in place.
Hopefully. Because then they're the unexplained causes.
Of
But
course.
the gist of it is this, that it's the most like I already said, it's a very famous line that the cliched advice is always the best advice. Just have to take it.
This has been a very interesting chat, and I hope that men listening to our chat find this useful, learn the fundamentals to have a great sexual health, and when they face issue, they go to doctors like you and seek help.
Thank you for having me. It was great fun, just discussing all these things. Because I think awareness is pretty important, especially in this sector.
Yeah.